Hey everyone, we have had a lot of requests to compare a few different supplement plan options, specifically Plan G, High Deductible Plan G, and Plan N. So let's talk about it. These are three great options to fill in the gaps left by original Medicare, and each comes with its own advantages and disadvantages. Like our other comparison videos, I'll break down how much each of these will cost you so that you can see your risk in a good year where nothing goes wrong and compare that to your risk in a bad year where seemingly everything goes wrong. I also include Part B premiums just so you have a complete picture of what your Medicare coverage will cost you. I took the average costs of the major plans in our surrounding 5 states to get these numbers. I'm located in the Rocky Mountains. These rates are highly dependent on where you live and the insurance companies that are available in your area. So you could have a slightly lower average than what I'm going to show, or you could have considerably higher averages in certain parts of the country. A relative constant throughout all of these in most cases is the Part B premium. So we'll just put that right up here. Remember that the Part B premium is income dependent. So those with higher incomes could have higher Part B premiums, and those on Medicaid or lower incomes could see no Part B premium. However, the vast majority of Americans will pay $164.90 per person per month as their Part B premium in 2023. That is $1,978.80 per year. So let's get into this comparison. We will start with regular Plan G versus High Deductible Plan G because they are both Gs. We've covered this extensively in videos on our channel, but the average premium for a Plan G in our surrounding states for a 65-year-old is $150.43. I'm going to round that to $150 to keep math easier for me. So premiums are $150 per person per month, which is $1,800 per year that you would pay whether you use healthcare at all or not. The one regular Plan G gap would be the Part B deductible of $226 here in 2023. That is an annual deductible that resets every year on January 1st. So in a good year where nothing goes wrong with a regular Plan G, you're looking at an annual cost of $3,778.80, and in a bad year, $4,004.80, the difference being that Part B deductible. Again, that includes your Part B premium. All right, with a high deductible Plan G, the premiums are much lower. The average around our area is $56 per person per month or $672 per year. Already a big difference. The deductible in 2023 is $2,700. This is the amount that you must pay first before your plan helps. After the deductible is met, the High Deductible Plan G works like the regular Plan G. So in a good year, your annual cost is $2,650.80, a savings of $1,128 over regular G. In a bad year, your annual cost is $5,350.80, or a loss of $1,346 compared to regular Plan G. All right, finally, let's move into Plan N. The average premium in our area is $120 per person per month, so it sits there between the Gs. That is $1,440 per year. The deductible is the Part B deductible of $226 per year in 2023. Now, Plan N is different in that it doesn't cover quite as much as the Gs do. Plan N has 2 copays to consider. The first is up to a $20 copay each time you visit a doctor's office, and the second is a $50 copay each time you visit the emergency room that does not result in an admission. If you are admitted to the hospital, this is waived. Now, Plan N has one other gap that the other two don't, and that would be excess charges. An excess charge happens when you receive treatment from a provider who does not accept the Medicare-approved amount as full payment. In this case, a provider can charge you up to 15% more than the Medicare-approved amount, and you would be responsible for this excess charge with Plan N. You would not with the Gs. So in a good year, you're looking at $3,418.80 as your total cost, again, including Part B premiums. A bad year is tough to calculate with this one because it's highly dependent on how often you visit providers and which providers you visit. So just for this example, let's say that you visit a doctor's office once every month, so $240 in copays. You visit the ER twice and you're not admitted, so $100. And then for whatever reason, you have $300 in excess charges. Then you're looking at $4,058.80 with Plan N. Again, that is highly variable on how you access the healthcare system in that year. And if you notice the premium differences between a regular Plan G and a Plan N, it's about $30 in our area. So with that $20 copay each time you visit the doctor's office, you can see that if you're visiting the doctor more than twice a month, then the Plan G is ultimately going to be less expensive. The Plan N will become more expensive. All right, there is the comparison with strictly dollars. Please remember that these costs vary dramatically and access to reputable carriers that offer these plans isn't always available in your state. For example, there are some states where carriers actually have a more expensive premium for Plan N than Plan G, the regular Plan G, which is crazy, right? This is because there is more administrative work for the carrier with Plan N in general than there is with Plan G, and they don't want people to write Plan N. So in some cases, Plan N and regular Plan G premiums are more than $300 per month for a 65-year-old. And that reminds me, supplement plan premiums will increase over time. There are two ways that they can increase. The first is the annual increases that most insurance companies have to account for inflation and rising healthcare costs. The second is age-based premiums, where every year on your birthday you move into a different age category and your premium goes up. There are plans that are community rated that do not increase based on your age, but they still have the first regular increases most years. Again, there are years where you won't have any increases and other years where you will have more. So you could see 1 or 2 rate increases each year with any one of these plans. The last thing to note on premiums is that none of these plans come with Part D prescription drug coverage, dental, vision, or hearing aid coverage. If you want these plans, you can purchase them separately as their own standalone plans with their own premiums, deductibles, and copays. So who likes which plan? Well, regular Plan G is the most popular right now in the country by a decent margin. The reason is because Plan G appeals to people who, number one, can afford the premiums, and number two, they don't want to worry or think about healthcare costs. They like that they can have their premium, they can visit the providers that they want to see, they can get the surgeries or the care that they want, and as long as it's approved by Medicare, they only have that $226 deductible. They can kind of set it and forget it for the most part. Plan G is also best if you have high chronic illnesses with high hospital and medical costs that you know will cost you a lot every single year. High deductible Plan G is for people who are a little bit more cost conscious around their fixed monthly costs and they want lower premiums. They are generally healthy and they bet on the fact that they will have more good years than bad years. They have some money set aside for the bad years if that $2,700 deductible comes into play. By the way, that deductible does go up a little bit every year, and they don't want the risk of an Advantage plan for things like the network and the freedom that original Medicare gives them with the supplement plans. Now, Plan N sits kind of in between the two. A person who isn't comfortable with the highest premiums that come with regular Plan G, but also isn't comfortable with the $2,700 deductible, they are banking on the fact that they won't have a lot of doctor visits or ER visits, as well as the fact that they will seek providers who accept the Medicare payment as the full payment amount. All right, that wraps up our comparison of these 3 great plans. If you'd like to see what one of these would look like for you or a comparison of the 3 of these and their costs in your area, feel free to reach out to me at this email address. We are not licensed in all states, so if you are in a state that we do not work in, we can connect you with people that we trust who are licensed in your state. Thank you for taking the time to learn more about Medicare. I hope it was helpful. If you have an agent that you are working with, please use them. Your agent will save you time, money, and stress, and they will be there for you every year as the whole Medicare landscape evolves and changes, which it does. If you don't have that person, well, you know what to do. We're here to help. I appreciate you, and thank you for watching.